Welcome everybody to another Zoom call and number of that came in. Remember to send your questions in on the form on the member site if you remember to do that. Otherwise, you can just chat them in through the chat um, during the call. All right. Remember to look at your members homepage, especially for any updates. In the last week or so, we've had numerous updates with the Rife. Um, TrueRife is having trouble with the 6.4 software. We're recommending currently that you don't upgrade to 6.4 right now. I have numerous videos on how to do it. If you do and you're running fine on the 6.4, well then just stay with it. But I won't go over that. I went over this last week and it's right on the site. So I'll let you guys look at that. All right, question. What is your opinion about urotherapy, urine therapy? In my case, it is applying urine to an open cancerous tumor. Well, urine therapy has been around for a long time. It's controversial, like so many things are. The idea is that your own urine contains healing benefits and healing nutrients that can help heal wounds. There's even been urine therapy where you drink your urine. Um, Urine, it does sound very gross, but your urine should not have bacteria or in it. So it's not like it's, going to contaminate your body unless you have a UTI of some sort or a bladder infection. You should not have any bacteria or viruses or pathogens in your urine. You don't expel those through your urine. Um, but I don't have a strong opinion about it because I have not had anybody over the years that has done it um, that has really given me any feedback. So I don't know. Honestly, I don't know if that would be beneficial or not. I don't think it would be harmful. So as a different person, I will send you my labs when I get them all back. But 2 weeks ago, my hemoglobin was up to 9.3. Remember, hemoglobin should be over 12 usually, but you don't really get concerned until it gets down into the eights or the sevens. And today it's down to 8. So, of course, a low hemoglobin is probably your best indicator on fatigue. So, hemoglobin is a part of anemia. So, in different types of anemia, you'll have low hemoglobin, low red blood cells, low B12. There's different types of anemia, but the anemia that you get with cancer is called anemia of chronic disease. That's actually the name of it. But with cancer, it has to do with multiple things. But one of them is that cancer can be gobbling up your iron and causing anemia. Cancer can be causing bleeding, causing anemia. Cancer can the cancer therapies like chemotherapy and radiation can cause anemia. So the rest of this person's question, I'm still taking the supplements you put me on, but would radiation knock it down? Is there anything else I could be doing? So this person just had radiation, and yes, radiation is a major cause of anemia. So radiation can knock that down. Now, once you're done with radiation, your body will build that back up usually. So you don't really need, but there are some things you can do to help pull the radiation out of your body. And there's some further questions about that. So we'll touch on those in just a second. Um, but so let's move on. I have lots of edema in my legs, hands, which started on the right side, but now has moved to the left side. I have started occupational therapy to wear wraps and exercises. Is there anything else I can do? I have also done some lymphatic massage and some brushing. So I have several blog posts about edema and swelling and how to help move that out of your body. Remember that your lymphatic system does not have a heart. It works totally by action of the muscles. So you need to be moving your muscles, so if you have edema in your hands, you need to be doing some hand exercises, some arm exercises, anything that's going to contract the muscles is going to help to move fluid out of the tissues. So I would work heavily on that. Massage, deep tissue massage on your hands and legs can be helpful as well. They're stroking towards your heart. They're going to be moving fluid through the lymphatic vessels. And through the lymphatic vessels, there's typically a valve at the maximum 4 inches apart. So as you move fluid through that, then there's a check valve that it won't go backwards. So as you get things moving, that's going to be the most helpful. So what's the cause of the edema? So edema can be caused from blockage, physical blockage, because a person had lymph nodes removed. That's the most common that we talk about here, because a person might have had surgery and they had lymph nodes removed, so that they have less active flowage sites for the edema to exit. Edema can be caused from medications. That's probably the number one cause of edema, is different medications that a person has been on. Edema can be caused from chemo and radiation as well. So just working through those things. So you're doing some of these right things. I would say look at as far as other things that is possible is the swelling program, the inflammation program on the right, and make sure you're doing your ion ProWave programs that can help with detoxing that as well. I have lots of edema in both hands and legs, actually in my torso also. Not sure if this has anything to do with the hemoglobin or not. No, typically the edema doesn't have anything to do with the hemoglobin. So two separate issues. Can radiation cause edema? Yes and no. So radiation can damage blood vessels. Radiation can cause leakage because it is a toxin. Can cause leaky vessels. So you can get more edema from that. That's and especially if you have ascites in the torso, you think that could be tied to that, not tied to the low hemoglobin. What B12 supplement do you recommend that is not methylated? With regards to methylation, please explain the concerns with cancer, in this case, non-Hodgkin's lymphoma. So the concerns with using a lot of methyl groups is that methyl groups, what they do in our body is they turn off genes. So when a person has been termed, there's been terms that have been out there since genetic testing came out, that people can be under methylators or over methylators. I don't really use that terminology so much because you're not really an under methylator or over methylator. It depends on what you're consuming and what you're being exposed to in your diet as far as number of methyl groups. A lot of times when people initially did people's genetics, they found that the gene, the MTHFR gene, is there's two genes in that family, and the 1298 and the 677 genes, the MTHFR genes. Those were the first genes that had some research on them, and that showed that when you have defects on those genes, you don't methylate through the methionine cycle as well. So then a lot of nutritionists started giving people 5-tetrahydrofolate methyl groups in supplementation. And that ended up causing a real problem because it's more complicated than that. When you give too many methyl groups, it affects downstream different things. Methyl groups turn off different genes. and it can activate different pathways by turning off different genes. What they found with using too many methyl groups by practitioners that didn't take a big enough picture of a person's health is that it caused a lot of emotional issues, because if a person also has defects in another pathway called the biopterin pathway, you end up producing excess serotonin. And excess serotonin could cause rage issues and anger issues, and actually a person could become dangerous, that with excess serotonin. So using methyl groups in supplementation, you have to be careful, because you have to look at downstream pathways as well. If you have COMT defects, if you have defects on the serotonin genes, and you are using methylated B12, you can cause a lot of emotional upset, even OCD issues, anxiety issues. So you have to be careful with methyl groups that way. But with cancer, I take a little bit different approach to this, because excess methyl groups will turn off genes. And one of the genes that we're trying to stimulate through using like curcumin and other anti-inflammatories that are getting rid of NF-kappa beta precursors, which are inflammatory precursors, we're trying to clear the way so that certain genes, especially what are called the tumor suppressor genes, are able to turn on. And that's what helps stimulate apoptosis of cancer cells or cancer cell death. Now, if a person with cancer is taking a methylated supplement, they have to be careful with it and only take that for a period of time for a very specific purpose. And I just talked to somebody on the phone today that I would say they should take a methylated supplement for a period of time for the specific purpose, because their homocysteine levels are too high. So homocysteine is the final downstream piece of the methionine pathway. And if the homocysteine levels are too high, then you should add some methyl groups for a short period of time, a couple weeks, and test the homocysteine test again, and you test homocysteine through the complete metabolic profile. So should a cancer patient with normal homocysteine take methylated folate or methylated B12? I say no, because you don't want to turn off tumor suppressor genes. Excess methyl groups will turn off tumor suppressor genes, but I said they'll do far worse than that. Excess methyl groups will cause issues with the biopterin pathway, cause emotional issues, cause anxiety issues, and that is often, the reason why a person may have emotional issues. I've talked to people over the years where they were giving their child methylated supplements and they couldn't figure out why Johnny had so much rage and so much anger, and he was labeled now ADD, ADHD, and he wouldn't listen in class, and it all had to do with this methylated folate that the mother was thinking that she was doing him a favor by giving it to him, and all of a sudden you take that away from him, and all of a sudden all his emotional issues calm down. So you can do harm with different supplements, so you have to be careful with that. That's the long answer to that. We typically recommend B12 in the form of pro-hydroxycobalamin. So there's 3 forms, well, there's actually 4 forms of B12 out there. Methylcobalamin, which is the most commonly used, and I think it is one of the most commonly misused supplements. That's a methyl group. So cobalamin is B12. It's either tied to a hydroxyl molecule, it's either tied to an adenosine molecule, or it's tied to a cyano molecule, or it's tied to a methyl molecule. I don't recommend cancer patients take methylcobalamin. I don't recommend anybody take methylcobalamin unless they have looked at their biopterin pathway also from a genetic standpoint, and they monitor symptoms from an emotional standpoint. But cancer patients, I recommend either adenosylcobalamin or hydroxycobalamin. This company, PHP, Professional Health Products, or Methyl Genetic Nutrition, makes both. the prohydroxycobalamin and proadenosylcobalamin. Either one of them are good supplements. Either one of them work just as well. Both of them are lozenges, and that's the way to take your B12. Can you take too much B12 in the form of prohydroxycobalamin or proadenosylcobalamin? And the answer is really no. It's a water-soluble supplement that's not going to stay in your system, and it will circulate in your blood. And it's not uncommon for a person to do a blood test and show elevated B12 levels, and then thinking that, or their medical doctor who's not knowledgeable in understanding that will say, oh, you got to get off your B12 levels are too high. Your blood B12 levels being too high causes no issues whatsoever. Matter of fact, many times blood levels of B12 too high tells us that the person isn't getting B12 into the tissues, and they need to keep B12 at that high level because they may not be getting them into the tissues. I've seen people with elevated blood B12 and they're not even taking any B12. That really tells you that they're not getting B12 into the tissues, and that can be a B12 anemia. So you have to be still taking B12 even though your blood levels are high. So that's a common misconception of reading blood work. But the hydroxycobalamin or adenosylcobalamin is just fine. Supplements with the fourth type of cobalamin or B12, the cyanocobalamin, should be avoided completely. I am totally not a fan of cyanocobalamin. It is a synthetic and I think more toxic type of cobalamin. Is it common to experience more pain from a tumor when exposed to the right overnight frequencies? The answer is yes, that is common. Do look at our blog posts too. We have a blog post on good pain, bad pain, and I have, some things written about what I wrote, but there's a video on that blog post called Good Pain, Bad Pain. Watch that video, and that will help you discern, what is going on and what is normal, what isn't normal. Do you recommend certain supplements to take along with FOLFOX chemo? We have read that berberine and artemisinin have synergistic effects. We are also planning to do IV vitamin C and ALA pre and post chemo. All of those things are good. The only thing that I would be careful of with the FOLFOX chemo is an IV chemo is to follow the chemo protocol that's on our blog post. Again, look up chemo protocol instead of good pain, bad pain, and you'll see about doing a fast before chemo, staying off of your antioxidant type nutrition for the 48 hours. You can do that always with a IV chemo, doing a fast prior to it and staying off oxidative supplements for 48 hours so that the chemo will work better. Berberine and artemisinin are typically classified as antioxidants. They will help synergistically work with any chemo. Really, any of your immune supplements are going to help with chemo synergistically working better because it just helps your immune system to attack chemo. Same thing with not just with chemo, but with immunotherapy. So over the 6 years since my diagnosis, I have seen very slow things happen in my breast. I was perfect after a year of all nutritional healing. Then things begin to feel as if bad things were happening. Now it seems they see nothing of significance in it, yet it is hard. Feels like calcified in most of the bottom half. This person is talking about a breast tumor. What would this be from? Well, you'd want to look at some scans to know exactly what it's from. But many times a tumor will wall itself off and will become hard inside and yes, even pick up minerals and calcium because it is dead tissue. So that is a good thing. And I've shared a story before about a patient I had a number of years ago that had lung cancer and multiple tumors in their lung, and their surgeon was begging them and begging them and really becoming very pushy about surgically removing those tumors. And finally, the person came to removing the tumors, and the doctor said, and these are his words, the surgeon's words, it broke up like a puffball. And it was all dead cells in the tumor. And he wished he wouldn't have done the surgery because the surgery was supposed to take X amount of hours, and it took 3 or 4 or 5 times that long because the tumors just literally broke apart and he had to clean out all of the tissue. So yes, that's the goal of, natural care. Isn't necessarily, I know it's everybody's goal for the tumor to disappear and it's not there and they say they're cured. But really the goal is for it to stop growing, because by definition, it's not acting like cancer anymore. It's not replicating. So many times your body doesn't know what to do with that mass and it will just wall it off. So it can become calcified. The real concern is it larger? Has it gotten larger? Is it getting larger? Is it metastasizing? The only way you're going to know that is by getting further scans. Recent lesions found in my liver and many small tumors in my spine and pelvic. Doctor, not concerned much about the small ones, yet I get severe pain with being on my feet too much, as in normal day activity. What do you recommend for pain? What does no damage to the liver or stomach? Well, whenever you have pain, you always want to find out why. So whenever you have a symptom, you don't just want to find out how you can take the symptom and make it go away. You want to find out why the symptoms are there. So if the pain in your being on your feet too much is in normal day activity is from the tumor, if it's from a tumor or metastasis in your spine, you want to address that. So you don't want to magically, even if you could, make that pain go away, because then you wouldn't be getting the signal that something is wrong. So you do want to address that. If you have metastasis in the spine and it is causing pain, you do want to address that. And that's where I would suggest that radiation might be an option if that's what they've talked to you about, and it might be a good option, because when you could do spot radiation on a bone, many times you could kill the cancer that's in that bone. I'm not a big fan of radiation to soft tissue, but radiation to bone can be really life-saving in a lot of different ways. I did not see recommended protocols in the members area for radiation treatment where there is daily oral chemo pill on days of radiation treatment, which is 5 days a week. So if you're doing an oral chemo pill, you really can't do the chemo protocol. So the chemo protocol that we write about in the blog posts is really for an IV drip of chemo that takes place over a period of a couple hours, and then you're going home, and now you're staying away from, you know, you know, antioxidants like we discussed in that, and we've discussed multiple times, and now you could go back on that. So typically, I recommend, if you're on a daily chemo pill, even if it's just 5 days a week for the period of radiation, or the daily chemo pill that many breast cancer patients go on, that they're on, for years sometimes, that you don't change your protocol as far as nutrition goes. You're still staying on antioxidants. You're still staying on your other nutritions. If you're doing IV vitamin C or you're doing anything else, you don't really change that. Now, you might not do IV vitamin C that, during the 5 days of radiation, but you certainly go back to that to help pull that out of your body. And that's another thing about this question here about what do you do to pull radiation out of your body? Well, using all your chelating type nutrition is going to be the best thing as far as a radiation protocol, radiation treatment to help pull radiation out of your body. To follow up on that question before too, these are two homeopaths that we have. We have our homeopath that can help pull radiation out of the body. and this radiologen, which can help pull radiation out of the body too. These are just different homeopaths. Now, in truth, nothing is going to work perfectly. Our chelator is going to pull radiation out of the body somewhat. Nothing is going to be perfect for radiation. That's the deleterious effects of radiation on our body. It just can stay in our system like forever. So whereas chemo is a chemical, that chemistry, you can chelate that and theoretically pull that out of your body. Radiation affects tissue and damages tissue that it is more long lasting, and you have more long lasting ill effects of it, possibly too. So the more things that you could do to heal, the better. So last week, when asked, you recommended continuing IV vitamin C during radio chemotherapy, but when would you do IV vitamin C infusion so that the vitamin C does not neutralize the effects of the days of treatment? So I would, if the chemo pill, you're only doing it for those 5 days of radiation, I would wait until after the radiation to do an IV infusion. Can you do liposomal vitamin C during that time? Well, again, there's different theories about this. Some practitioners would say, absolutely, you should be doing it every day. That'll help protect your healthy cells during the radiation. It's hard to argue with that being a strong possibility. But you want that radiation to work as best as possible. So if it was me, I'd probably wait even with the liposomal vitamin C until after I was done with those 5 days. It's not like it's 30 days that you're waiting on this. If I was doing a 30-day session of radiation, which isn't uncommon with a lot of people with cancer, then I would probably stay on the liposomal vitamin C. But for 5 days, I think I would go off of it and then maybe wait another day or so afterwards and then go back on it. I just finished 10 a lot of radiation questions here. Treatments, I was doing high dose vitamin C and was feeling worse after my IV. So this is a different person. It's not the same person who asked that last question. On the call, you mentioned to take a break, which I have, yes. So is there anything else I can do to help get the radiation out of my body? So these things, any of your chelators, any binders, the clear binder, any other binders that you're taking, all those things will help. So again, nothing's going to be perfect to pull radiation out of your body, but binders, chelators, homeopaths, antioxidants, glutathione, vitamin C, all those things are going to be the best thing to pull radiation out of your body. When we spoke earlier today, you said to take zinc and vitamin C to help reduce my high copper levels. Do I take them at the same time, or do I take one first and the other later? No, I sent those in your package today, so you don't need to order them. I threw bottles of both those in there that got shipped out with that bulb today, so you don't have to worry about ordering them. Take them at the same time. So take the zinc and a teaspoon of I gave you the liposomal vitamin C and a bottle of clear zinc. I would do 3 a day, the zinc and the vitamin C. Do watch, like I said, so a person that has copper toxicity, which a lot of people do, it's very common. A person that has copper toxicity, if you start taking zinc, because that's what you would help, that's what you take to pull the copper out of your body, you could actually feel sick, because zinc will grab copper out of the tissues, but it ends up dumping it in the blood, and you can end up with technically like a Herxheimer type reaction. So you can feel ill, you can feel like fluish, you can feel sluggish, you can get headaches. But if you take vitamin C with the zinc, and it can be just ascorbic acid that you have at home, but I had some liposomal vitamin C, so I gave it to this person, which is even better. But taking vitamin C with the zinc helps grab on to the copper. It helps it pull it out of the body. So I'm not a fan of using copper in supplements. There are whole food supplements that have copper that's naturally occurring. There's no getting around that. But any supplements that add copper to them, especially in doses that exceed the daily limit of copper, you're getting copper in your vegetables. It's not like we don't need copper. It's just that we get too much copper. And even copper that we're exposed to as a child. Let's say you lived in a house that had copper pipes, which like probably 60, 70% of the homes in America have copper plumbing. A lot of people use copper cookware. A lot of people have used those copper bands. Copper does absorb through the skin. It was very popular, a couple of years back to use copper for people who have arthritis. It's really helpful. No, it's not. Excess copper is really dangerous. So, and copper for cancer is even worse because copper helps stimulate growth, and we don't want that. But excess copper, whether you have cancer or not, can lead to what's called copper toxicity and can push out zinc levels. And you really need zinc to stimulate an immune response to help kill cancer. After my mastectomies, I've been working with a physical therapist to prevent lymphedema. No problems with that, but I am getting cording, which feels like cords that run from my underarms to my mid-upper arm. The PTs are working with me, but can't explain why this happens. Do you know? And is there anything else I can do? Well, it's a matter of just doing everything possible to help move the lymph. Cording occurs when you have blockage because it almost always occurs when you've had blockage because you had removed lymph nodes or post-surgery. So just keep working on that. Things will go away. Edema settles in your tissues and in the fascia layer as well. Just keep working on it. You got to be patient with it too. Don't try to push it too hard. And you can irritate things too. I mean, if you're doing heavy, deep tissue massage or something, you could actually be irritating the tissues and causing more edema. So you got to go gentle with it. I'm getting ready to do the mycotox lab. As instructed, for 3 days, I'm avoiding taking my glutathione and all cell core supplements because they have binders in them. Anything else common to avoid? Is NAC okay, or avoid that too? I'd avoid the NAC too. N-acetylcysteine, the reason why you take it is because it's a precursor to glutathione. It helps stimulate glutathione recycling. So I would stop that too. I'm extremely low on B12 and I am anemic still, but improving slowly. So I should not be taking a B12 methylcobalamin, but instead hydroxycobalamin. Yes, that's my opinion. You should be taking hydroxycobalamin, not methylcobalamin. And the only people I think that have cancer that should be taking methylcobalamin is if you also have high homocysteine. So if you have elevated homocysteine levels, then you need to take methylcobalamin for a period. It doesn't actually have to be methylcobalamin, it could be methylfolate too. But
my homocysteine levels are normal.
Okay, so then go on a hydroxycobalamin or the adenosylcobalamin, either one. You might have them in your cupboard, but either one of those. You should also use a lozenge because B12 is difficult to absorb for a lot of people through the gut lining, and a person could be taking plenty of B12 in whatever form, but they have pernicious anemia, meaning they don't make the enzyme for the pathway to absorb it through the gut wall. So that's why you take a lozenge and you refrain from sucking on it too quickly because you want it to absorb through the buccal mucosa of the cheeks, not through swallowing. You're not just sucking on the lozenge and swallowing the deliciousness of the tasty lozenge, because you want it to absorb in your mouth and not in the gut. So be careful of that, anybody that's taking B12. My new batch of Chinese herbs caused my intestines to feel raw and caused diarrhea. So this person is taking Chinese herbs from a different practitioner. Because I was so depleted, I did an IV vitamin C with methylated Bs with a glutathione push. Now I feel this was a mistake. I have flu symptoms, low fever, and spasm in my neck. Any suggestions on how to feel better? So let's talk a little bit about the methylated Bs that you would get in an IV. So really so typically if you're going to get B vitamins in an IV, they're going to be synthetic. They're not going to be whole food vitamins. So I'm not in favor of taking B vitamins in an IV at all, unless the person's gut is so damaged they can't absorb Bs and you have to do it that way. Then you have to do it that way. Doing methylated Bs on one instance, like an IV of methylated Bs, isn't going to be a mistake. So that in itself, just because they were methylated, doing it one time, don't consider that a mistake. I just don't want you taking methylated Bs on a supplement on a daily basis when your homocysteine is within normal limits, because you can be causing those other things that we talked about earlier. I have flu symptoms, low fever, and spasm in my neck. I doubt very much it was from that one instance of methylated Bs. And I doubt that it's from the glutathione, though I know the person asking this question is very sensitive to different supplements. And when you're doing IVs of any supplements, you're taking fairly high doses, so you're really flushing your system. So the fact that that took place could be an issue. So a lot of people will ask, can I do glutathione with my IV vitamin C? Because the practitioner that I'm going to that's doing IV vitamin C, she said we could do these other things in the IV too. Of course, they're selling bags of this stuff, right? Well, is a bag of glutathione beneficial? Well, the answer is yes and no. So when you're using glutathione, so go back to the 7 phases of detoxification thought process. Detoxification is like a river. So if there's a blockage anywhere, or let's say not a blockage, but there's an impingement somewhere through that river, and you start pouring more water into that river back upstream, then you're going to cause a flooding downstream. And that's what maybe is what you're experiencing. Glutathione functions really on the phase 0 level, because glutathione, yes, it does support phase 2 pathways in the liver, because glutathione does function there. But glutathione's primary function is really intracellular, meaning in all your cells. It helps. It's so important that way. It is your main intracellular antioxidant. But it also will, if you have a lot of toxins in cells, it can dump toxins. If you take excess glutathione, it can dump toxins into the blood, and it can overwhelm. If your phase 1 pathway is a little restricted, you could have excess toxins flowing through your bloodstream, trying to get out through phase 1 of the liver. And phase 1 of the liver is like, hey, dude, we have a waiting list. You have to keep circulating. And these toxins have to circulate again, coming back to the liver again. Hey, can I get in now? No. I told you to take a number. And they have to circulate again. That's what makes you sick. So when you use chelators in excess, when you shouldn't be using too many chelators, I see this often. Well, people are like, I did a test with my practitioner. It said I had mercury toxicity. He put me on EDTA and DMSO and this DMSA and this chelator to pull out this mercury, because I got to get this out of my body, and I felt sick afterwards. It's because of this reason why I'm saying so. The only thing you do is support the liver, support these pathways, make sure that you're having good bowel movements, do coffee enemas if you possibly can. If you can't, make sure you're doing castor oil packs over your liver. Make sure you're doing hot packs at least over your liver. Make sure you're using binders to grab onto stuff so that that's not the pinch and that you're reabsorbing this stuff. And drink a lot of water, just kind of flush yourself out and you should be fine. My gut is still sensitive. Now that is dealing with this new batch of Chinese herbs that's caused your intestines to be an issue. I've said that's why I don't use Chinese herbs, because I just don't trust the suppliers. And there's too many contaminated stuff coming out of China, to be honest. So using some things just to calm your stomach is going to be your best thing. Calm your guts down. Has anyone ever mentioned any external hemorrhoid issues with doing the coffee enemas? I do them daily for the last 2.5 years. Love them. Developed what I think is some bothersome hemorrhoid. No, anything's possible. Just the irritation of the tube could cause issues. I haven't heard it cause a hemorrhoid. I do have a blog post on hemorrhoids and things that you could try to do on it, though. I don't remember the nutrition off the top of my head. Radio chemotherapy is 5 days a week for 5 days with the chemo pill. Ask Dr. Levy, vitamin C expert who actually answers emails, if I should continue reordered IV vitamin C protocol, which I've been doing for 6 weeks now, goes for 12 weeks. His answer was I wouldn't change anything. Yeah, so there's a lot of people are like, continue to do that. So there are papers that seem to support this as well. I would agree. Is there a lot of NaC in clear tox? I'd have to look at the ingredients again. It doesn't say, but it is listed first. I would just go off of it for 3 days. And that's going to be a bother to go off it for 3 days just so you get a clean reading. I had implants put in on Friday. Recovery is going well so far. That's good, good, good. Surgeon said it was very high risk for reoccurrence because I didn't do chemo, radiation, and tamoxifen. No, doctors don't use scare tactics at all, do they? Noted, but I'm still going to pursue natural healing. Any input for anything new I should do now for recovery going forward? Also, is it true that it will take about a year for the swelling from the surgery to go away? Well, I do think everybody's different with that, so they probably say that so that they get less people complaining. But no, I don't think it's going to be a year for the swelling to go away. So especially when you're doing other things to help with that. Getting a lot of comments from case reviews that I'm on the phone with, just the high pressure that oncologists are using on people to get them to do their procedures. It's just to me, it's just highly unethical. Are you familiar with the books Practice of the Emotional Code and the Body Code? I've not read the books, but have a Christian friend who does it for me and others. I have other Christians friend who has rejected it recently due to concerns of evil spiritual activity. I do not think the emotional code and the body code is involved in any evil spiritual activity. I think they're just fine. They are just using different acupuncture points and different things that can help stimulate your body. They may use new age, words in that, like chakras and different things like that, but I don't think you practicing it as you pray over the practice of it, you're doing anything wrong from a spiritual perspective. I know there's different Christians out there that just literally throw everything out. I used to have a pastor once that said, you shouldn't be doing acupuncture because that is, anti-Christian. And I said, it's far more anti-Christian for you to go to a Chinese restaurant run by a Buddhist, non-Christian, than it is for you to go to an acupuncturist who's a Christian. Acupuncture is not a spiritual technique whatsoever. It never was. It is not practiced that way in China or any other country as a spiritual technique, where you could argue that yoga is a spiritual technique. You can't argue that with acupuncture points, because it isn't. And so I wouldn't be concerned with any evil spiritual activity that's involved with emotional code, or kinesiology, or acupuncture, acupressure points. I'd be careful of any practitioner you go to that is doing anything. But goodness sakes, your oncologist very well is probably not a believing, practicing Christian. So, I mean, you have to use wisdom in whatever you do. Are you familiar with the Emoto water and paper remedy, putting water over written words and using the water for healing? Yes, I am. There's a book written about it. I can't remember the name of the author, but your words are powerful. You could actually find many biblical verses that tell you how powerful your words are, that you shouldn't be speaking negative things over yourself. That's something I have to catch myself all the time, because I tend to use derogatory humor about myself, because I deal with stress with humor. Not very funny humor, but it's humor. And see, there again, there I go. But speaking negative things over yourself is very damaging. You have to speak positive things over yourself. Paul exhorted us in Philippians chapter 4 to talk about, if there's anything pure, anything lovely, anything holy, anything worth complimenting, worth thinking about, worth being positive about, focus on those things. That's what we're supposed to put our focus on. He's speaking to a church that's being persecuted by the Romans. So just because we're going through tough things, we can't be thinking of how tough what we're dealing with is. We have to go, hey, God's got a purpose for this in me, and praise God, I'm alive today. Hey, God didn't promise that we're going to be alive tomorrow. So we need to be thankful for every single day above ground, and know that God's got a purpose for me today. How am I fulfilling that purpose? How am I bringing him glory today? It's certainly not whining and crabbing about, how icky I feel, or, how sick I am. And so we got to be careful of that. We have to guard ourselves for that. And you should put people around you. This is my opinion. You should put people around you who love you enough to rebuke you. Iron sharpens iron, the Bible says, meaning that you need to have somebody around you that's willing to slap you in the face when you're not acting godly and your conduct is not glorifying God. We have no right, I don't care how sick we are or how difficult our life is to be victims. Nowhere does it say that you have a right to be a victim in Scripture. And believe me, we live in a time where we are the richest country in the world. We are the most comfortable country ever to live on this planet. We live in homes that our ancestors would only dream of, that kings and palaces of old weren't as nice as $150,000 suburban 2-bedroom Rambler are today. So we have nothing to crab about, and we need to have people in our life that will hold us accountable to us not allowing ourselves to be a victim. I think I wrote some blog posts on that talk about how you can't afford to allow yourself to have those negative thoughts. So, I'm not a believer in positive thinking Christianity, but I am a believer that negative thinking Christianity does one no good. So there's truth to our attitude is so important. I have a bladder infection. You recommended Crayozyme 3 to 6 a day. I'm concerned about possible lower immunity and that it could go to my kidneys, but I do not want to do antibiotics. I read your blogs about UTIs. I'm doing probiotic infused yogurt rectally, vaginally. Are there more supplements or practices that could be healing? You start with one thing at a time, definitely. And most bladder infections are viral, they're not bacterial. So most bladder infections, most UTIs don't do well with standard antibiotics anyhow. So good, continue with the coffee enemas as well. Okay, with that, we will bid adieu for the night. Know that I'm praying for all of you and keep up the good work. Keep focusing on healing, keep a good attitude. And like Paul says, if there's anything good, focus on that and understand your purpose is to bring God glory. It's not to heal. It's not to, have joy. It's not to anything. It's to bring God glory, no matter how difficult our circumstances are. All right. Bye-bye, everybody.